We now turn our attention to healthcare inequality, and particularly the issue of race. Because no discussion of disparities in medical care in the United States can avoid the fact that systemic racism is at the heart of those problems. Health is more than access to medical care. And we talk about this in terms of the social determinants of health, which include economic stability, neighborhood and physical environment, education, food, community and social context, and the healthcare system. And looking at this graph, you can see that there are lots of things that go into this, from employment to transportation to education and opportunities for both higher ed and vocational training, as well as early childhood education. We have to be thinking about hunger and access to healthy foods, not just food deserts, but food swamps where the food that you have access to is just not particularly good for you. Um, we need to look at the stress that discrimination causes. What are the support systems available? And then, and only then, can we really talk about the healthcare system. So lots of things are taking place before we even get into the context of the medical system. And all of those things, though, have to do with health. And we see it play out in lots of ways. And it's important to note that racism affects all people of color in the US, but the burden falls particularly hard on Black communities. We can look at life expectancy based on CDC data from 2014, which is the last time we have available data. Black Americans have a lower life expectancy at 75.5 years versus white Americans who have 79 years. Okay. It doesn't look like a lot in that, but we're talking about averages. We're talking about real huge disparities. And it should be noted as well that the US is lower. It's ranked 31st in the world behind other countries. So we're not doing well, and we're really not doing well in terms of serving everyone in society. Certainly infant mortality rates, if you look at this, it is more than double for Blacks what it is for whites. So 4.7 deaths of infants per 1,000 births versus 11. This is really inexcusable. We look at the uninsured rate for non-elderly people because, of course, when you get into Medicare, we see something different going on. And again, 7% for white Americans, 11% for Black Americans. And we can go further to say, where is it that people are accessing care? Well, 14% of white Americans only are using the emergency room as a source of healthcare, while it's 20% for Black Americans. So all of this is our backdrop before we get to the impact of COVID. And we see the consequences of these disparities and of structural racism in stark relief with COVID. Black Americans have been among the hardest hit. Black people in the United States are 1.4 times as likely as non-Hispanic whites to contract the disease and 2.8 times as likely to die from it. A recent survey by the Kaiser Family Foundation found some statistics on this in surveying people. 51% of Black people surveyed said that someone in their household had lost a job, was furloughed, or had their hours or income reduced as a result of the pandemic. 32% reported that the pandemic has had a major negative impact on their ability to pay for necessities. 66% feel that the government's pandemic response would be stronger if white people were getting sick and dying at higher rates than people of color. Just feeling that disparity itself is another stress that is placed on these communities. 65% report not being confident that the coronavirus vaccine development is taking the needs of Black people into account. And 49% would not get a coronavirus vaccine if determined to be safe by scientists and available for free. So nearly 50% of those surveyed will not get a vaccine. And we have to wonder why that is. Well, there is a deep suspicion of the medical system among Black people. And this isn't paranoia. It is cultural knowledge passed on from generation to generation, as well as lived experience. And we can look at this. It is real because that suspicion is born from a history of scientific racism. And the history of the medical system's treatment of Black Americans is horrific. Doctors claimed that Black people were immune to diseases and couldn't even feel pain, which they felt gave them permission to perform medical testing on Black people. Now, many of you have probably heard of the infamous Tuskegee study. It was conducted between 1932 and 1972 in Tuskegee, Alabama, by the U.S. Public Health Services. And the study followed the natural progression of untreated syphilis in poor, rural Black men who thought they were receiving free health care from the U.S. government. But in reality, what happened was that the investigators enrolled 600 impoverished Black sharecroppers from Macon County, Alabama, 399 of whom had previously contracted syphilis before the study began, and 201 without the disease. For participating in the study, the men were given free medical care, meals, and free burial insurance. But they were never told that they had syphilis, and they weren't treated for it. According to the Centers for Disease Control, the men were being told that they were being treated for bad blood, which was a local term used to describe several illnesses, including syphilis, anemia, and fatigue. What was particularly insidious about this study is that by 1947, there was a treatment for syphilis. By 1947, penicillin had become the standard treatment. But instead of simply giving these men syphilis treatment, what they did was that the scientists continued to study these men without treating them. They withheld penicillin and information about syphilis and the impact of it from them. And this actually affected their wives and their children as well. The study continued under numerous U.S. Public Health Service supervisors until 1972. It began in 1932. And only then, when there was a leak to the press, which eventually led to the termination of the program. The victims of the study included numerous men who died of syphilis, wives who contracted the disease, and children born with congenital syphilis. Now, the Tuskegee experiments are the most infamous, but they are certainly not the only cases of mistreatment of Black Americans at the hands of the medical establishment. And we can go back early. Thomas Jefferson exposed hundreds of slaves to untried smallpox vaccines before he used it on whites. Marion Sims was a leading 19th century physician and former president of the American Medical Association. He's often referred to as the father of gynecology. But Sims developed many of his gynecological treatments through experiments on enslaved women. He didn't, these experiments that he performed, he didn't even use anesthesia, claiming that these women were immune to pain. Sims was pitiless with non-consenting research subjects, and he used this research to benefit white women. But those abuses didn't stop early in the country. They kept going. In the 20th century, some examples, throughout the 1950s and 60s, Black inmates at Philadelphia's Holmesburg prison were used as research subjects by a University of Pennsylvania dermatologist who was testing pharmaceuticals and personal hygiene products. Some of these subjects reported pain and disfigurement. In the 1950s, the Army and the CIA deliberately exposed Black Floridians to swarms of mosquitoes carrying yellow fever and other diseases. During the 1960s and 70s, a researcher at the University of Mississippi who believed brain pathology to be the root of children's supposed hyperactivity behavior subjected those children to sometimes paralyzing neurosurgery. And in the 1990s, Columbia researchers investigating a hypothesis about the genetic origins of violence injected Black children in New York with fenfluramine, which was half of the deadly discontinued weight loss drug fen-phen. This is only a small sample of the atrocities committed against Black Americans by the American medical establishment, sometimes with direct orders and or tacit consent of the federal and state government. And it's little wonder then that the Black community views the medical establishment with suspicion. When medical practitioners and public health officials do not know or do not acknowledge this history, they are unable to treat and help members of the Black community. Medical practitioners who want to see themselves as healers must recognize the ways in which historically they have been the perpetrators of grave harm.